Assalamu alaikum everyone, this is Dr. Hassam Anjum Mir back with another video. In this video, I am going to guide you on how to take an impression of an implant supported crown using indirect method with pickup impression coping. So in the last video, I taught you how to expose the implant in the second stage surgery. You can find the link of the video in the description below. And in this video, I am going to take the impression of the same patient so that the flow of the treatment maintains, and you can see how we proceed from the second stage surgery towards the final insertion of the crown. So the advantage of using an indirect technique is that we take an implant level impression and send it to the laboratory. The laboratory then incorporates the implant analog into the model and places the standard abutment over the implant and then fabricates the crown. In this way, the lab has the full access on contouring of the abutment. They can grind the abutment in any way they want, or if an angled abutment is required, so it is easy for them to select which degree of angle and in which position the angled abutment would be ideal, so that the screw hole, if you are making a screw-retained implant, comes over the occlusal surface of the molar crowns and palatal surface of the anterior crown. Although in every case it may not happen that way, but it becomes easier rather than doing all these procedures chairside, which increases the clinical time as well and discomfort of the patient as well. So these all procedures are done in the laboratory. So in this video, I am going to show you step by step how to place the abutment, create a hole in the impression tray and then take the impression, so that you can easily follow this guide and do the procedure in your clinic as well.
So as the healing is now completed, you can see that the soft tissue all around the healing abutment is healed in a proper shape. I'm going to remove the healing abutment to evaluate the healing on the inside as well. We should see a beautiful color of soft tissue all around with a slightly red bleeding surface.
So as the soft tissue is healed, now we are going to start with the impression process. First of all, tray selection. A disposable tray is required so that you can cut out a hole in the tray, which we are going to use for this impression technique. These are the abutments that we are going to use. As you can see that the abutment has a long screw. This screw head protrudes through the hole that is made in the tray, so that you can unscrew it after the impression is taken. So you have to seat the tray intraorally and first out find the exact position of the implant, mark it and create a hole in the tray.
So I'm going to place the tray in the position and then identify the position of the implant by looking in the mirror, so that I can identify where the implant is positioned according to tray. I'm going to place the finger. You can mark it using a marker as well over the place, and then I'm going to grind a hole using an acrylic burr. So now I've placed the pickup impression coping, and I'm going to verify that there is enough space around the impression coping to record the impression and it does not interfere with the borders of the. So you can see that we have enough gap around the abutment so to record the impression properly. We are going to take impression using addition silicone, two consistencies, light body and heavy body. So I'm going to place the light body. You should do it in a continuous motion to avoid any bubble. So I'm going to insert the heavy body upper, and the main thing is that you should expose the abutment head so that you can unscrew it later, because if the putty hardens and the head is not exposed, you will have to cut the tray to remove the impression material, because it will be difficult for you to find the head in a set putty and unscrew it so that the abutment engages the implant. And the putty also blocks the screw head, but that is not an issue. Once it sets, you can remove it easily with the probe and then unscrew it. The material is set now, so I'm going to first clear the head of the screw by removing the impression material so that the key engages the screw properly. I'm going to now unscrew the this screw of the abutment. You have two options: either if it is easy, for example in posterior teeth it is difficult due to limited mouth opening, you can either remove the whole screw or you can just loosen it like this and then remove the abutment, it depending upon the space and operator preference. So I'm going to remove the impression material. So you can see beautifully how all the teeth and the soft tissue is recorded. So once the impression has been taken, you now have to insert the implant laboratory analog over the impression, so that when the technician pours the impression, this implant analog is incorporated into the model. So you place the key back into the impression material through the abutment, and then place this engaging the hex of the abutment and then tightening it either by hand or by using the key. You should not tighten it too much that it rotates within the impression material, light pressure. Also keeping a finger so that it gives support, you can tighten it lightly. After recording the impression, you are going to take the jaw relation of the patient. It is very important because as I have used half trace, so the articulation is difficult without the jaw relation record. If you record the full arch impression, then you can avoid the jaw relation record, but for half trace it is very important there, so laboratory can properly articulate the models. And then you record the shade of the patient, and after that the healing abutment is placed back over the implant so that the soft tissue does not grow back, and the profile maintains till the appointment of the crown cementation. A very important tip in this regard is that you have to record the jaw relation without placing the healing abutments. The reason is that the laboratory does not have the healing abutments there. So if you record the jaw relation with the healing abutments, the material jaw relation record material that flows around the healing abutment, as there is no healing abutment on the models, it may interfere in the seating of the impression or inaccurately seat. So it is very important that you record the jaw relation without the healing abutments, and after that you place the healing abutments and send the patient back. So this was the clinical guide for recording impression using the indirect open tray technique with the pickup impression coping. So thank you very much for listening to this video. I am going to attach the links of the other videos in the description as well, so you can watch them as well, and kindly like this video and subscribe to my channel, and also share this video with your colleagues. So if you have any query or question, you can write it in the comments or email me or contact me on the personal number that I have given in the description. So thank you. Allah Hafiz.